When patients come to me and they're just missing a single tooth or maybe a segment of teeth, just a few teeth are gone, we have an approach to that where we really want to, one, my philosophy is always to minimize the number of surgeries that we do. So let's say a tooth needs to be taken out. Ideally, we want to take the tooth out that's broken and put an implant in at the same time, do any grafting that's needed to minimize the surgical procedures that are needed. If the site is already healed, the tooth's been out for a while, and we find that there's adequate bone, we're going to place an implant, and then we're going to attach to the implant. When the implant is ready, we'll attach what's called an abutment and then put a tooth on top of that. That's called a crown. And it's as simple as that for a single tooth. And if somebody has several missing single teeth like that, we can do that in all those spots. And typically when the site is healed, that's a very minimally invasive procedure that doesn't even require stitches or incisions. The second type is if they're missing a segment of teeth, a few side by side, we might place an implant on each end of that segment and then build what's called a bridge from implant to implant to replace that entire segment all at once. If the bone is adequate, we can do maybe even an individual implant in each site. So patients have good options. There's ways to create different price points in both situations. But the idea is that we're basically building tooth retained or implant retained teeth that allow people to get right back to their natural function.